Hello, I will be performing a head-to-toe assessment on this newborn today. I'll show you the right ways to do that. I'll start in by coming in with the introduction. Hello, my name is Sam, going to be your nurse for today. Going to be performing a head-to-toe assessment on this newborn. And I'll check behind me, make sure the door is closed, make sure there's enough privacy for this. And then I'll move on to washing my hands, getting them clean. All right, be back. All right, with clean hands, now it's time for some gloves. All right, gloves on now for safety, to be clean, and I'll be checking the name tag. I'll check the name tag on the baby, and I'll match it with the mother's as well, making sure the right identification. So now it's to begin the assessment. So the baby here, we see the level of consciousness. The baby is asleep right now, so it's the right time to first begin with assessing the heart rate, the respiratory rate, and the temperature. So baby is swaddled. Let's take that. And now, I'll be auscultating the heart and the lungs to be hearing there as well. And make sure I'll be auscultating with the bell. That's better for newborns. So let's check the heart. All right, hearing all that, and now to check the heart rate, I'll hold this at the apical pulse for 1 minute. Okay, it's been a minute. So the heart rate was at 133, and that is within normal range. So we have a healthy heart here. The right range for newborns is to be between 120 and 150 beats. So we have a healthy heart rate. So now going to be looking at the lungs as well for assessing the right respiratory rate. The right respiratory rate for a newborn should be between 40 and 60 breaths per minute. So be observing that to make sure there's a clean airway and the right breathing patterns for the newborn. And after that, I'll be checking the temperature of this baby. Should be done for an auxiliary temperature underneath the arm. Hold this here for also a minute. All right, it's been a minute. Now let me read that temperature. All right, it was 98.2 degrees Fahrenheit. That is also within normal range. The right temperature range for newborns should be between 97.5 and 99.3. to keep the right temperature regulation of the newborn. So now we got these vital signs. These are looking all right. Yeah, they are within normal range, so we have some healthy vitals for this newborn. So I'll move on to assessing the head of this baby. Finish unwrapping. So now with the head, we'll start with removing this and assessing the fontanelles, both the anterior and posterior fontanelles. The anterior should be about a diamond shaped, and making sure it's soft. I'll be running my finger along the head to be feeling it. And the posterior fontanelle as well. That's a more triangle shaped, also soft, and make sure it's feeling all right. The top of the head looks pretty solid, the structure. And also to be looking for any signs of cephalohematoma, because that could be a sign for jaundice to be developing and more abnormalities, so that's also to be looking for. Oh, don't see any of that here, so now I'm going to move on to the eyes. I'll be using my pen light to look for reaction with the eyes. Make sure that they're open. Let's take a look. All right. So these eyes were reactive to the pen light. These eyes, and making sure the level of their open, making sure there's symmetry between the eyes, and making sure, looking at the color as well, because be poking in to look at the conjunctiva. And if you notice there's any or significant amount of pinkness around the conjunctiva, that can be a sign of pink eye. So that's something to look out for. Could be dangerous for newborns. So these eyes, all right. Now I'm going to be moving on to the ears. Ears, just making sure, checking the tissue, checking the structure of these ears, and making sure that they're balanced and attached well. And I'll be looking at both ears as well. Symmetry is important here, making sure they're both similar in their structure and lined up on the head and attached well. So feeling those, and then after that, time for assessing the nose now. The nose, making sure it's the right shape. I'll take a look at that. All right. And I can be closing one of the nostrils and see the motion of the other for nasal flaring. Making sure that is developed well. And bilaterally, both eyes, or both noses, both nostrils, making sure the other is flaring as well. And now, it's time to be assessing the mouth. The mouth now. First, I'll take a look at it, and then one finger can go on there to be feeling for the palates, soft palates at the top. That's important to look out for. And also, I'll be checking for reflexes, the sucking reflex and the rooting reflex. The sucking reflex, making sure if the baby will be sucking on my finger. If it is, it shows the ability to be sucking, so the baby will be prepared for breastfeeding, for sucking on the nipple. And also the rooting reflex, in which I could be softly rubbing, softly palpating, the cheek. Now if I'm palpating the baby's left cheek, the head would be turning a little bit in this direction, showing, reactions that way. And that's important as well. And then now it is time. Now we can move on to the neck. For the neck, I'll make sure there's no webbing or nuval thickening. Making sure the skin is intact there as well, taking a look. All right. Important, just working your way down, starting there. And now onto the chest. The chest, I'll again look for intact skin, making sure both nipples are present. That's also important to be looking for, because that will show proper fetal development and proper development of the newborn. And softly palpate, see the motion, or seeing the right chest movement, and with the nipples, making sure there's symmetry there as well. Just all across the body, continue to be assessing for symmetry. And then it can be time to be listening for bowel sounds. Again with the bell. Okay. Bowel sounds were present in all four quadrants. So it was good to be doing that, and now also just making sure there's some self-palpation there. And the abdominal area is looking well. And also should be looking at the umbilical stump, making sure there's no oozing or bleeding there. That could be happening, and something to take note of, but this one, I don't notice any oozing or bleeding. So the right development of the umbilicus. No infection, and it's not dry. Next up, we can be taking off this diaper here. And here, I will be looking at the genitalia. Looking at for any redness, irritation, and it's important, male or female, to be looking for the opening of the urethra and to see if there's any bleeding or any irritation there. That's what I will be looking out for. And also self-palpation, if it's a male, of the testes, knowing that they have begun descent into the scrotus, and feeling for softness. For females, looking at the labia majora and labia minora, looking at the structure of those and any signs of bleeding, or just to keep that in mind to assess there. We can put the diaper back on now. Alright, and after that, I'm going to be looking at the back. I'll roll this baby over a little bit, take a look at the back, and I'll be looking for any Mongolian spots that could be seen, but that could be common. And also a sacral dimple. That is very important to look for. That can be a sign of an abnormality and improper development of the spine. So that would be something to report, something important to look for, a sacral dimple. This back, I did not notice any sacral dimples here, and I saw symmetry, with the spine still in development, but saw symmetry was, so far, proper. After that, going to be looking at these arms. Now it's time for the hands. The hands, I can have my fingers in them to look for the reflex, the plantar grasp. Making sure reflex is present, is able to have the proper hand motion, and looking for symmetry as well in the right shape. There's balance here. There's symmetry between these hands and fingers. And also it's important to count the digits. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All of these digits are present, all 10. And should do so with the toes as well. The toes also, I notice reflex here with motion of the on the toe, seeing gripping with the toes. And I'll count these digits as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All digits are present there. We can lower these arms back. And one last thing, and we can wrap this baby up again. On its back, make sure on its back for a clean airway and back to sleep. And that is the newborn head to toe assessment.